get a bite registration from this impression. Have the patient bite down into their normal occlusion and check the bite just to make sure it's right. Gently remove the impression by gently placing your fingers at the border and gently lifting the impression up. Inspect the impression and make sure that there are no tears or impression material that might have been left in the mouth or under the bone. And you can see what a beautiful impression this is. The wound is approximated and sutured. The impression is then sent to the laboratory for implant fabrication. This impression is poured up and then mounted directly into a little articulator. The implant can be designed to fit within the bite, and then the implant can be made that will fit perfectly. The first impression surgery is now completed, and now we're going to talk about the insertion surgery or second stage surgery. The second stage surgery is exactly the same as the first surgery up to the time of implant insertion. Therefore, we will pick up the surgery after the time the bone is prepared for the placement of the implant. The tissue has been flapped, the tissue has been tied back, the bone cleaned up, and now it's time to notch the bone. Carefully place the transfer template over the bone. Make sure the template fits snugly and doesn't move one way or the other. Then cut the notches with a rounded cone carbide slow-speed laboratory burr. Cut until the facets in the bone match the template. The transfer template is now fitting snugly over the bone and is ready to be notched.
Put your sucking tip right on top of this.
Like this?
Yeah. Is that okay?
Mm-hmm.
Okay. Once the transfer template is secured, then the notching procedure begins. Use copious amount of water so that you don't burn the bone. You can see that the crossover notches are now cut, and in the mirror you can see the shape of the burr that I used in a laboratory to fabricate the transfer template. The template is fabricated so that there's no question as to where the facets of the bone cut end and where they begin. Okay, the notches are now cut and I'm removing the transfer template. The notching procedure is now complete. We're now ready to start to place the implant, but before we place the implant we want to treat the surface with PRP. We want to wet the entire surface with either the patient's PRP, whole blood, or plasma. This material will absorb onto the surface and actually becomes a patient as far as the body's response to the implant is concerned. Any saliva or patient's bacteria that touches the implant during the delivery will be mitigated to some degree by this coating. In this case, because of the maxillary subperiosteal plus the two unilaterals, we're going to use the patient's plasma because of the amount of fluid needed to wet the entire surface of all the implants. Now wet the 4060 HA granules with either PRP, whole blood, or plasma. In this case we're using PRP. Add thrombin to the mix to coagulate the mixture. This forms a putty consistency that is easily grouted around the implant heads and strut. This is the PRP being added to the HA. This is the thrombin being added to that mixture, and notice how it clumps up the mixture into a groutable mixture. It's now time to place the implant. Try to avoid the tissue as the implant is inserted. Make sure that the implant fits the bone very snugly. Place a titanium bone screw, and the implant must sound integrated at this point when tapped. Even though my hand covers the placement of this implant, I'm carefully sliding the implant in over the bone, avoiding contact with the tissue as much as I can. The implant is now placed, and as you can see, it fits very snugly around the bone, and when you take your finger and push it around, it doesn't move at all. The sutures are removed from the relieving incisions, and is now ready to start the grouting procedure. Grout the bone mixture around the implant using a spatula. Grout the coagulated bone mix into the area between the implant struts. Spatulate the material into the notched voids. Then I placed Grafton around the abutment heads, and it serves as a barrier for bacteria as it heals. After grouting, then release the tissue flaps. I'm now relieving the tissue flaps. I haven't showed the grouting procedure, but if you'd like to review it, go back to the Custom Indacio maxillary implant and review the grouting procedure. The releasing incision on the mandible, especially on the buccal, is different from the full maxillary releasing incision, in that we have to protect the metal nerve. So when we're releasing it, we're picking up the buccal flap and then releasing it just under the flap so that we get into the soft areolar tissue so that we can pull that across the implant. On the lingual, you can actually just tear the tissue attachment away from the underlying fascial planes and then be able to pull that over the implant. As I move posterior with a relieving incision, I can actually get down and release more periosteum to pull over the implant. Here I'm releasing the lingual flap with a pair of tweezers, and I'm just grasping the lingual flap and pulling up and gently tearing it away from the underlying fascial tissue. I'm now adding a little bit of Grafton around each of the heads and tamping it down and feeling that that will produce a little bit of a barrier effect for bacteria that might seep in around the implant heads. As I place the Grafton, I tamp it down with a dry gauze, and this helps to compact it and to mold it into the areas that I would like to see it go.
Yeah, fine or not?
Yeah.
It's good?
Now we're going to approximate the tissue and suture. Add a little PRP to the wound as it being sutured. It helps the healing process. We're starting the suturing procedure by closing the anterior releasing incision, then tying the flap together behind the bicuspid, and then working our way posterior to the posterior relieving incision. To save time, we're not going to show the entire suturing procedure, but now the suturing is done, and in the posterior mandible, I usually don't make it temporary. The patient is ready to go as soon as you're done suturing. This represents 3 weeks post-op healing, and as you can see, by 3 weeks the tissue is nice and pink, and it's very, very healthy and tight around the implant heads. At this point, the implant is ready for final impressions and crown and bridge procedure. The final crown and bridge can be cemented in from about 4 to 6 weeks after the placement of the implant. We tell the patients that broken bones take about 6 weeks to heal, so we feel confident that about 4 to 6 weeks the patient can start to chew with this implant. Here's the pre-operative x-ray showing the upper arch, which we had done the Custom Indacio implant on in the previous DVD, and then you can see the lower where we did the unilateral mandibular Custom Indacio implant. This is Nancy's post-op x-ray. I thank Nancy for enduring